So in the X-ray spotter series, we have seen few chest X-rays. Today we will discuss regarding this particular X-ray that you are seeing here in the background. X-ray KUB or X-ray kidney, ureter and bladder. Just observe this, what you are able to see. So you are able to see two foreign body inside, which is nothing but DJS. What is this DJS? Double J stent. Double J stent you are seeing on this side also and that side also. X-ray KUB showing double J stent. So what are the follow-up questions that might be asked? One is, what is the structure it is connecting? One is pelvic calyceal system of the kidney and the urinary bladder. This is what it is connecting. Kidney with the bladder. It is what it is connecting. So why it is called a double J? So here in the kidney side there will be one structure, or this tube is somewhat folded to form a J shaped in the upper part, so that it won't be passing out or get dislodged, and down also there will be some J shaped folding. That is why it is called as double J stent. Why it is placed? It is a hollow tube. It will be a hollow tube where inside there will be a passage for the urine to pass down. Basically it is indicated in obstructive uropathy. Whenever the kidney urine passage is obstructed, this kind of stent is being placed. Whether it should be compulsorily placed on both the sides? No. Whichever side there is obstruction, this can be placed. A hollow rigid structure, so that obstructive uropathy, the urine can be passed from the kidney to the bladder. That is why DJ stent. What is the ideal length? It depends on the patient. The range vary from 28 cm, 30 cm, depends on the patient. Because ideally if you take the ureter size, on an average 20 to 30 cm, accordingly the size is. It is usually somewhat lengthier than the ureter, so that from the pelvic calyceal system and to the bladder it can be placed safely. Once that fold is made, the J fold is made, it will be kept in position. How it is being done? Through the help of cystoscopy. Cystoscopy is bladder. Cystoscopy, the endoscopy counterpart of the kidney urinary tract system. Through the cystoscopy, this DJ stent will be placed. Any obstructive uropathy is an indication for the DJ stent. Stones, any kind of stricture in the ureter, tumor, a thick pyonephrosis. Sometimes if the drainage have to be done, the drainage can be done from externally also, which is called percutaneous nephrostomy. Tube and all can be placed. If not, inside intra-body drainages, this DJ stent can be placed. So any kind of obstructive uropathy, as I told, stones, stricture, tumor, pyelonephritis, pyonephrosis. Pyelonephritis as such is not an indication. When the drainage pathway is affected, that is an indication. Even in emphysematous pyelonephritis, yes, this can be placed to facilitate the drainage. Ideally, how long it can be kept in situ? Up to 3 months. 3 months is the time duration where it can be kept in situ. Not absolute, can be varied as per the patient situation. Why it can be varied? Because we have to find the etiology. The etiology have to be treated. Once the etiology is treated, and that is the time for the DJ stent to be removed. Is there any complication associated with that? Yes, during the procedure, there is a risk of bleeding. The stent itself might get infected. Dislodgement of the stent. Many a patient comes in OPD and says that while passing the urine, the stent came out. These kind of scenarios, dislodgements can happen. Sepsis can happen because of this. Any foreign body inside the body can act as a sepsis foci at any point of time. Nowadays, advanced DJ stents, silicone DJ stents are available, but most likely that might be a higher order question. A basic order question might be indication, whether it is an open procedure or just a scopic procedure. So it is not an open procedure, endoscopy wise placement, 3 months time duration they might ask. Indication, obstructive rubble. That's all. If you know, for a PG student, probably if you diagnose this as bilateral degestant, more than enough. For a DM student, probably these kind of discussion might be revolve around this particular X-ray. So that's all. Previously also in many short we have showed this, how this appear in the CT, how it is appear in the X-ray, unilateral degestant, mislodged degestant, and most of the images are already were being uploaded in the channel short itself. You can check out if you want to know for your exams. So that's all. If any further doubt related to this X-ray, you can comment upon. In the next video, we'll see regarding some other exams. Bye bye.